Hello everyone, my name is Kesni Perumal and I have recently completed my master's degree in physiotherapy. In light of this, I have been granted this opportunity to share information on an area that is very close to my heart. Unfortunately, the current restrictions in South Africa and the world at large has led to this tutorial being received on an online platform. But I am thankful to still share this information with you while we all do our part to flatten the curve. Please feel free to contact me with any questions you may have following this tutorial. My email address will be made available to you at the end of this video. So, wherever you are, sit back, relax, and absorb as much as you can as we begin to discuss the perceptions of schooling for children living with HIV. In the year 2009, it was estimated that 5.2 million people were living with HIV in sub-Saharan Africa. 10 years later, in 2019, an estimation of 7.97 million people are living with HIV in South Africa. Authors Hoy Ellis and Fredrickson Golson discuss that while the prevalence of people living with HIV has increased, the light in which HIV has been viewed for decades has conceivably changed, as HIV is now regarded as a chronic disease rather than a terminal illness. Improved access to antiretroviral therapy and the treatment for the prevention of mother-to-child transmission of HIV has led to an overall decrease in the incidence of HIV infection in children. However, South Africa still has an estimated 280,000 children between the ages of 0 to 14 years living with HIV and AIDS. While advancements in ARTs have improved the life expectancy of children living with HIV, they are, however, experiencing a sudden onset or worsening disability. The World Health Organization described disability as the challenges experienced by an individual across three domains: impairment in body structure and function, limitation in the ability to carry out an activity, and participation restriction. HIV-related disability may be caused by the pathological consequences of the disease itself as a result of opportunistic infections or as a side effect from the ARTs. Several studies document the disabling effects of the virus on children living with HIV, evidenced by impairments in vision, hearing, speech and language, motor and neurocognitive development, and functioning. These impairments place restrictions on the child's ability to participate in the fundamental aspects of their lives, such as schooling. School readiness is the preparedness of a child to succeed at school and is determined by their level of cognitive, physical, emotional, and social development. Children living with HIV are at risk of impairments in one or all of these developmental categories, resulting in poorer participation and progression at school. HIV-related neurocognitive impairments, such as problems with executive functioning and information processing, are expressed as difficulties related to attention and verbal learning, memory, and fine motor performance, leading to school readiness delays. HIV-related physical impairments, such as difficulties with mobility and dexterity, may hamper the independence that is required for physical functioning in the school environment. Furthermore, socioeconomic and contextual factors play a significant role in the readiness of the child to participate in the school environment. In South Africa, the majority of children living with HIV emerge from low socioeconomic backgrounds. Children living with HIV affected by poverty face challenges that include poor growth due to inadequate nutrition, unresponsive caregiving due to parental illness or orphanhood, and challenges to accessing appropriate education and medical care due to resource limitations. Caregiver illness has been found to result in a lack of adequate educational stimulation in the home, which contributes towards poor school readiness, performance, and attainment. This state of play is exacerbated by the low availability of and enrollment in early childhood education programs for children in resource-poor settings. Opportunities for inclusion in appropriate school readiness activities are thus reduced, as well as the potential for early identification of school-related functional difficulties. Early identification of disability and referral to rehabilitation has been recognized as a necessary step to improve early childhood development of children living with HIV and to enhance their levels of participation and progression in the school environments. Schools are now being recognized as primary environments for the development of children's health and well-being. UNESCO asserted that schools should provide education, counseling, and psychosocial support, and ensure adequate nutrition and healthcare services for children. However, although South African education policies advocate for schools as environments that foster and support inclusivity, the implementation is lagging far behind. Children living with HIV are educationally disadvantaged, with reduced levels of school enrollment, attendance, and progression due to socioeconomic and physiologically disabling factors. Rehabilitation focuses on addressing life-related consequences of living with HIV. Since HIV-related disability in children may impede their ability to participate in crucial childhood vocations such as schooling, a multidisciplinary team of professionals, including educators, should be established so that integrated interventions may include the continuity of care at school for children living with HIV. Recent literature exposes the lack of efforts focused on the disability and rehabilitation of children living with HIV in South Africa. This study sought to explore the perceptions of educators and healthcare workers on school readiness and participation of children living with HIV in order to inform future rehabilitation efforts to foster success at school. With all this being said, I'm sure most of you are asking yourself the question of how this applies or relates to you. Well, rehabilitation professionals play a significant role in improving school readiness and participation in children living with HIV. Authors Worthington, Myers, O'Brien, Nixon, and Cockerell in 2005 described rehabilitation as a dynamic process that includes all prevention and/or treatment activities and/or services that address body impairments, activity limitations, and participation restrictions for an individual. The World Health Organization has prioritized the early identification of children with disabilities, especially in the reduction of the influence that impairments have on the level of participation a child is able to receive or achieve. The International Classification of Functioning and Disability and Health, or ICF as we commonly know it, supports the biopsychosocial model, which integrates both the biomedical and social approaches to disability management and the disablement of an individual. This encourages an overall understanding to improve the disablement of an individual, as well as improving an individual's level of overall functioning and participation. Disabilities of children living with HIV focuses or occurs across a broad spectrum, thereby indicating the various multidisciplinary team members that need to be involved in the care of the child. Disabilities include, but are not limited to, learning-related problems, speech-related difficulty, hearing impairments, visual impairments, and physical impairments. These impairments influence the ability of a child to cope with the demand of the school environment and adequately participate in the tasks required of them. Hence, various rehabilitative services such as physiotherapy, occupational therapy, speech therapy, and audiology are necessary for the holistic care of the child. Other related conditions like malnutrition and TB have multi-system effects and affect the neural development of children. Therefore, the services of a dietitian and psychologist should also be incorporated in the unification of therapies. Each rehabilitative professional has a unique role to play in the facilitation of school readiness and participation for children living with HIV experiencing disability. Authors Mancini and Costa in 2004 examined the functional requirements that predicted the level of participation in a large cohort of school children with various disabling conditions. The results of the study demonstrated that successful participation in the school environment was associated with the ability to meet the performance requirements of both physical and cognitive activities. The study concluded that therapists need to consider the context in which the child functions in order to understand performance and then structure meaningful interventions. Similarly, a study conducted in 2008 emphasized that interventions by rehabilitation professionals should be aimed at modifying the desired tasks in the context of the school environment in order to promote adaptive capacity and limit participation restrictions, thereby enhancing school readiness in children living with HIV. This practice assists in limiting the impact that motor, cognitive, and behavioral challenges have on their school participation, as well as providing the necessary education to educators in the school environment for early identification and intervention of such challenges. Furthermore, rehabilitation professionals' insights positively influence caregivers' educational decisions and regular school attendance of children living with HIV. Since healthcare and education are among the most fundamental aspects of a child's development and care, interdisciplinary engagement between educators and healthcare professionals may assist in the preparation of children living with HIV experiencing disabilities for greater participation in the school environment. So, my experience during my community service year led me to ask several questions that I could not obtain answers for, which resulted in me completing my thesis in this area. My study was conducted in a resource-poor setting in KwaZulu-Natal, and four major themes emerged from the data with regards to the perceptions of schooling. The theme Influences of Living with HIV on School Readiness, Engagement, and Progression describes participants' understanding of how a child's physical and cognitive impairments associated with HIV influence their readiness for school, their participation at school, and their academic progression. Participants further recognize the social aspects that influence schooling for children living with HIV. The theme Stakeholder Support Practices to Enhance Bonding and Bridging highlights the concepts of bonding, or the establishment of relationships based on shared feelings, interests, or experiences, and bridging or forming partnerships between the groups of people responsible for the care of children living with HIV. The theme Obstacles to Support describes participants' perceptions of the factors that challenge their ability to provide the support necessary to foster the school readiness, participation, and progression at school for children living with HIV. The theme Future Directives to Foster Success at School for Children Living with HIV encompasses participants' recommendations to address the obstacles that hinder success at school for children living with HIV. Participants recognize the broad influence that living with HIV has on a child's readiness for participation in and progression at school. Participants understood disability within the biopsychosocial framework as a diverse concept of impairments, including physical and neurocognitive impairments, limitations in activities, and restrictions in the participation of a child's daily school life, as described by the ICF. Physical and cognitive impairments were both identified as negatively influencing the school readiness, engagement, and progression of children living with HIV. Physical impairments such as cerebral palsy and weakness from malnutrition were perceived to affect the child's ability to engage in academic and physical school activities due to the high physical demands of the schooling environment. Cognitive impairments and other functional difficulties, like hearing impairments, were perceived to have affected the child's ability to grasp academic concepts, which limited classroom engagement and progression of children living with HIV. Hearing impairments related to HIV were perceived to influence school attendance and progression in this study. Authors Rapkap et al. In 2016 advised that this may be addressed by the training of teachers or linking these children with community-based rehabilitation programs. Apart from participation at school, these impairments were perceived to have limited the school readiness of children living with HIV, especially when their special needs were poorly addressed by their caregivers. Language and reading skills are critical building blocks for literacy and future academic progression and success. For children living with HIV in resource-poor settings, born into families with HIV, the chances of parental prioritization on academic child stimulation, like one-on-one reading time, is slim due to the many competing for domestic and healthcare needs of both the caregivers and the children. A lack of early childhood stimulation and engagement in early childhood development programs has been attributed to a lack of resources and caregiver awareness surrounding the concept of stimulation. A study conducted in a resource-poor, community-based early childhood center in Zambia showed the positive effects of early childhood education on school progression. The study emphasized that early childhood education is associated with better physical and cognitive development and a higher likelihood of on-time transition to primary school. The prioritization of early childhood education programs for children living with HIV in a resource-poor setting must be actualized in order to anticipate better schooling outcomes. Apart from academic performance, social functioning challenges contribute significantly to the difficulties that children living with HIV experience. These children are more likely to report that they are experiencing anxiety difficulties, forming friendships, and poor social support at school. Educators and healthcare workers should take responsibility of developing programs for age-specific groups whereby parents and caregivers are provided with a detailed description on stimulation techniques that incorporate available resources into their child's daily routine. Program activities can be conducted individually or in groups to assist in improving the social functioning difficulties that children living with HIV experience. This will assist in the facilitation of transitioning into a formal education setting while also providing the child with opportunities for early development. Such activities will also enhance the relationship between these role players, which can be further built upon as a child transitions into different phases of the school environment. Healthcare workers and educators highlighted their support practices of relationship building to enhance the care they were able to offer children living with HIV. In 2015, Campbell et al. Described bonding as the development of relationships between members of a network who are similar in some way. In the school environment, this would include positive social participation within the school, between pupils and peers, pupils and teachers, principals and teachers, teachers and parents or caregivers, teachers and healthcare workers, and so forth. The idea is to build strong relationships with people that share a common purpose of providing support to individuals that are affected by HIV and AIDS. Building relationships with the children contributes significantly to enhancing the overall well-being of the child. Taking a personal interest in the child's well-being led to children being more willing to provide information on the difficulties and challenges that they faced so that the proper assistance could be provided. Bonding with children developed a trusting relationship and hence facilitated the process of open communication, which gave them added insight into the individual needs of children living with HIV. Educators are considered frontline individuals to identify difficulties experienced by these children since they spend a significant amount of their day with them. In a study conducted in Kenya, Skofdal and Evans found that a remarkable ethic of care existed amongst teachers in response to the growing number of children that are affected by HIV. Teachers recognized the learners' needs and showed classroom flexibility to vulnerable learners, providing additional support and encouragement where needed. In the study, positive educator-parent relationships were seen to enhance the overall facilitation of participation children living with HIV in the school environment, as parents play a supportive role in the child's learning experience. The concept of bridging is described as creating horizontal networks of association that consist of reciprocal relationships between people who share broadly similar characteristics. Active advocacy by healthcare workers on behalf of the children for placement in special schools, for instance, is regarded as imperative to reduce the burden of disablement on the child's ability to function in a mainstream school environment. While one would assume that taking these measures is a regular practice, this is not the case, as evidenced by the many children living with disabilities in South Africa without placement in appropriate academic environments. A lack of interdisciplinary collaboration may be the reason for this gap in service delivery. Placing emphasis on the notion that every stakeholder is an equal contributor to the team may assist in the facilitation of bridging gaps to care that currently exist. Interdisciplinary collaboration facilitates timely intervention for children that need it simply because the channels of communication are solidly established. Obstacles to the level of support also exist. Poor knowledge of HIV affects the ability to anticipate difficulties experienced by the children. This lack of knowledge amongst educators is one of the most pressing challenges within the boundaries of care for children living with HIV. Educators who have insufficient knowledge about children's backgrounds and health conditions are therefore poorly equipped to deal with their struggles, rendering them incapable of referring such children to specialized health services. Non-disclosure has also been recognized as a major impediment to fostering success in the school environment. The disclosure of what is considered as a negative attribute in society can often lead to stigmatization and further compromise a child's well-being. It is important that all relevant stakeholders are aware of a child's status in order to provide them with the necessary support and assistance. Non-disclosure also prevents children living with HIV from being screened for disabilities at an early age. Poor communication and collaboration between healthcare workers, educators, and caregivers may lead to missed disability identification. While disclosure is a positive factor that assists in the building of a good foundation with parent-educator and child-educator relationships, there are also factors that undermine relationships in the context of poverty and uncertainty. These factors include, but is not limited to, teacher confidence in their skills, the capacity to support affected pupils, motivation to help children with complex problems, solidarity and common purpose amongst teachers and between teachers and affected children, and effective bridging alliances between schools and their surrounding communities. Interventions between rehabilitation professionals and educators in bridging these factors have been noted to improve educator and caregiver confidence and communication skills by enhancing their knowledge about the condition, thereby assisting them in becoming better equipped to deal with the challenges and difficulties they face in daily life. Such interventions, described by authors such as O'Malley et al. In 2015, reported that improved knowledge and abilities in supporting the pediatric patient, improving the child's understanding, and increasing the child's hopefulness for the future leads to greater confidence and willingness to engage in their respective environments. Hence, improved HIV education and training by healthcare workers, coupled with improved disclosure support, will improve educators' ability to anticipate difficulties experienced by children living with HIV. Disparities in the school environment were also deemed as an obstacle to support. The lack of integration between mainstream schools and special needs schools results in the creation of an academic gap for children who are not placed in a school able to cater to their individual needs. School infrastructures do not match the needs of children with physical disabilities, which negatively affects their well-being and school attendance. While the concept of South Africa's inclusive education policy and the release of White Paper 6 has been embraced nationwide, many view the concept as idealistic. South African schools struggle to incorporate and actualize the policy in resource-poor settings. The absence of resources, together with the negative attitudes towards disability, contribute towards poor inclusiveness in South African schools. However, healthcare workers and educators should be at the forefront of promoting accessibility to inclusive education for children living with HIV that are experiencing disabilities, and greater efforts at policy implementation need to be made. Along with the identification of obstacles to support, there are also recommendations on future directives to foster success at school for children living with HIV. Advocating for screening and the development of appropriate assessment tools was suggested in an effort to aid in the early identification, intervention, and treatment of disabilities that arise in children living with HIV. School has been declared as a valuable site for the identification of disabilities, as children living with HIV are associated with poorer attendance and educational delay. Early identification could lead to early intervention to improve school participation and attainment. A push towards the participation of these children in early childhood education programs is considered to be vital to promote school readiness and success in the school environment. Children need to be able to cope with several demands placed on them, and the earlier these coping mechanisms are developed by a child, the more transient the difficulties associated with school readiness, engagement, and progression. Children need to be stimulated between the ages of 3 to 6 years old so that they are able to adopt the necessary capabilities to cope within a schooling environment. In 2012, Brito explained that early childhood development is a multifaceted construct that includes the child and the context. Evidence on the promotion of early childhood development demonstrates this period as a foundational window of opportunity to resolve inequities, improve school readiness, and promote overall quality of life. Strengthening intersectoral partnerships through education and training may increase insight and raise awareness around definitive steps to be taken to enhance the school readiness of children living with HIV in their context. Building networks of solidarity between all stakeholders as well as the child will assist in overcoming common and individual obstacles to success. Such networks may act as a buffer to any friction that may arise in hindrance to the school engagement or progression of these children. The enhancement of interprofessional collaboration and sharing the wealth of knowledge between healthcare workers, educators, and caregivers will assist in the facilitation of early identification and intervention of children with disabilities in order to improve school readiness and participation. In resource-poor settings like South Africa, it is essential to maximize the proficiency of every multidisciplinary team member in order to share the burden and optimize the care offered to children living with HIV. The increased wealth of knowledge will create a stronger link between the referrals of stakeholders. A study conducted by Maddox et al. In 2018 described the negative influences that poor collaboration and knowledge of professional roles had on the management of people living with HIV. Kalembo, Kendall, Ali, Chimwaza, and Talon in 2018 emphasized the benefits of healthcare workers and educators working together with families living with HIV, and specifically training in the disclosure process. Participants recognized community outreach endeavors by healthcare workers and educators as two widely respected professional bodies to advocate for participation in early childhood development programs and for the initiation of and compliance with disability screening practices. Community caregivers were also recognized as key community members to be included into the support network for children living with HIV experiencing disability. Chetty in 2014 and Cobbing in 2017 emphasizes the integration of community care workers in the rehabilitation programs of people living with HIV in resource-poor settings. It is foreseeable that community caregivers might be an extension of the hands of both educators and healthcare workers in the community setting. So, with all this information, you might be asking yourself, how does it apply to you and what can you do going forward? As healthcare professionals, we have a responsibility to the community and to those around us. So why not try to reach out to schools in your area and raise awareness on physical and cognitive impairments that children experience and how this may influence their schooling career. Advocate for your profession by enlightening others on the benefits of having this knowledge so that early diagnosis can be made and intervention can take place in order to bridge this gap and enhance quality of life of the children that are around us. Build relationships with educators in these schools and allow them the opportunity to contact you in the future if they notice something extraordinary in a child that may require your advice. Set up workshops to provide valuable information and allow discussions to arise that can assist in bridging the dearth of information. Remember, each professional has a wealth of information in their various fields, but together we can share that and enrich each other. I sincerely hope that this has been of assistance to you all. You will find a questionnaire that will be emailed to you that you will need to complete in order to acquire your CPD points. And again, should you require further information or advice, please do not hesitate to email me at kesni@hgphysio.co.za. As Maya Angelou once said, be a rainbow in someone else's cloud. Be blessed always. Thank you.